Natasha, welcome to StarMed. My name is Dorian, and I am the head of marketing in StarMed. So thank you for making your time and your busy schedule to join this session today. For the benefits of our listeners, could you please begin by briefly introducing yourself?
Thanks for having me, Dorian. I'm Dr. Suh. I'm founder of the American Endocrine. I'm an endocrine surgeon and focused in thyroid, parathyroid, and adrenal glands, and I'm an RFA specialist.
Thank you. So we have invited you here today to discuss Thyroid RFA, which is Thyroid Radiofrequency Ablation. So for many listeners who are not familiar with those terms, could you elaborate in a simple terms what RFA is and the basic principle, how it works behind?
Sure. RFA is a exciting, relatively new treatment options for thyroid patients. By inserting a needle probe into the thyroid nodule, avoiding the surgery, you can ablate using the heat energy or thermal energy by applying electrical energy into the thyroid nodule, and it will shrink the thyroid nodule while preserving the surrounding normal thyroid tissue.
So it's like burning the nodules inside, and then may shrink to a minimal level.
It is. It's a very quick and effective way of treating a benign nodule or maybe a small, low-risk thyroid cancers by applying a heat and burning the thyroid tissue.
Okay, thank you for your clarifications. So from the patient's point of view, what are the most significant advantages of RFA when it's compared to the traditional open surgery?
It's truly a minimally invasive surgery where the procedure gets done under local anesthetics, meaning a small amount of a local injection into the skin site where the needle probe goes in to ablate the thyroid nodule. Because it's a low risk and minimally invasive intervention, it's done as an outpatient treatment, and which means no general anesthesia, no surgery, and you get to go home the same day. The typical treatment lasts for about 20 minutes to maybe up to 30 minutes. And you can walk out, you can eat and drink, you can talk, and you can carry on your daily life afterwards. Traditionally, the RFA has been applied for a symptomatic large goiter, meaning if you have a thyroid nodule that have grown over the years, that had been biopsied and shown to be a benign nodule, but if it has grown to a certain size, it can cause compressive symptoms, meaning having swallowing problems, sometimes breathing difficulties where you feel short of breath, or sometimes it can cause your voice change due to the pressure effect. And those patients can benefit greatly from RFA by simply burning the thyroid nodule to shrink the nodule to 70-80% of the size, or sometimes even greater. Conventional surgery involves going to the OR operating room under general anesthesia and having an incision. Depending on the size of your thyroid condition, it may be a small incision, it could be a big incision. But especially for people with a large goiter will require a larger incision. But doing RFA through a just single small skin puncture site, you can reduce the size of the goiter, avoiding surgery.
So the benefits seems quite clear. But is there any complications or reported side effects with these RFA procedures?
Sure. Just like any intervention, even if it's minimally invasive, you can have complications depending on the experience as well as indications for the RFA. But basic principle of RFA is applying heat source to burn the thyroid tissue. So you can potentially cause a heat-related or thermal injury to the surrounding structures, the windpipe, your food pipe. There are nerve, main nerve being the voice nerve that controls your vocal cord in your voice box. So you could potentially cause injury to any surrounding structures if you are burning too close to the edge of the nodule or the edge of the thyroid gland. Obviously, there are also blood vessels surrounding the thyroid and thyroid nodules. So while effective treatment of a thyroid nodule involves cauterizing or burning the thyroid vessels that feed into the thyroid nodule, you can potentially cause bleeding as well. So you want to be selective and you want to be very efficient in what you do. RFA overall is a very low risk procedure compared to surgery, where the risk of a voice nerve injury or well-established complication known as a hypoparathyroidism, where during thyroid surgery you injure parathyroid glands that control your calcium metabolism, calcium levels. That's well-known complications from thyroid surgery. From RFA, that risk is a very minimum, if almost none. Bleeding risk also is much lower in RFA compared to surgery. So as a procedure, it is very low risk intervention. And you mentioned the clinical effectiveness and the clinical studies. RFA has been around for almost 2 decades, and there are multiple peer-reviewed journal publications demonstrating the efficacy, the effectiveness, as well as the safety of the RFA. And that is reflected on the most recent 2025 American Thyroid Association guideline, which is considered the most influential guideline for the thyroid-related conditions. States that RFA can be done for not only benign thyroid nodules, but also for small low-grade thyroid cancers after careful evaluation.
Is it true that the large nodules can't be treated and has to be the surgery? Like, what do you think about this?
Yeah, that's an interesting myth. Patients and even some of the referring providers think that large nodules that are 4 or 5 centimeter or larger are not candidate for the RFA. On the contrary, those are the people who would truly benefit from RFA by avoiding a large surgery, large incisions, or prolonged surgery. By simply doing an RFA in an outpatient setting in a clinic, 10-15 minutes of RFA can shrink that nodule with a much improved symptoms from the compression as well as the cosmetics. Because if you have a large nodules like that, you may have a very palpable, causing compressive symptoms with the swallowing difficulties, or just have an undesirable, goiter that people can see. And something that also, because of the location, when you swallow, the thyroid nodule may move up and down, and that's not something that people desire to have. So it is very ideal treatment for those large goiter.
Is there any consequences if you perform an RFA that might affect of your future surgery or future thyroid functions?
Yeah, that's another myth that's around, but RFA does not compromise future treatment or future surgeries, meaning that as long as RFA gets done appropriately, it doesn't cause any scarring surrounding the thyroid gland, which will cause more difficult or challenging thyroid surgery. Now, one of the complications of RFA can cause thyroid nodule to rupture or thyroid tissue, the lining of the thyroid gland to be scarred. But if you have your RFA treatment done by an experienced specialist, that kind of complication is extremely rare. And going back to your question about whether it compromises future surgery treatment or future treatment options, it does not. You can have a repeat RFA if needed, which happens in a small percentage of patients, or if you have an indication for surgery for someone who may have either a new nodule within that goiter that developed cancer, then you may need to have surgery. It does not compromise the surgical outcomes. RFA compared to the conventional thyroid surgery, you're selectively ablating or selectively burning the thyroid nodule, preserving the surrounding normal thyroid tissue, therefore preserving the thyroid function to the best ability, which can mean someone who's requiring thyroid hormone for the rest of their life versus someone who does not require thyroid medication. It's not also all or none. Some people may require a small dose of thyroid medication, and some people may require full dose of medication, which means that they're fully dependent on synthetic thyroid medication. It's always better to have your normal thyroid function, and if you can avoid taking a full dose by having a natural your thyroid function, your quality of life will be better. So I think RFA confers that kind of advantage where you can preserve normal thyroid tissue preserving the thyroid function.
I was wondering if you could share a particularly representative cases of the patient you have treated.
Sure. Yeah, I can think of a patient who presented with a really big, left and right goiter. One
Two
side,
goiters.
yeah, two goiters, right. Some people have a propensity to forming thyroid nodules, and if they, wait long enough, some of the nodules can grow. For her, she was diagnosed with thyroid nodules over 10 years ago, and she wanted to avoid, having surgery, and her nodules unfortunately have grown to almost 10 centimeters on one side, and then the other side was smaller but still over 4 centimeters. And she wanted to and have a treatment option to shrink the nodule without having surgery. And she found out about RFA treatment and came to me for consultation. Needless to say, she was very excited about the fact that she was a candidate for the RFA. As we talked about, large goiter does not make you any less candidate for the RFA. Those patients will actually benefit more. And she was very happy to hear that RFA that can be done for her. So she had RFA. Because of the size of the goiter, I had to make 2 different puncture site for the probe, but she had the procedure done very safely, very effectively. I think the procedure lasted for about 20-25 minutes, and then she was discharged after the procedure. And within the first few months, her nodules have shrunk significantly to 60-70%.
Wow.
So she was very happy. And now we're talking about what do we do with the other side. So we're continuing to monitor her for now. And if the other side continues to grow, or if the side that was ablated grows over the years, she understands that she may require a repeated RFA, but she still prefers that over having surgery. She's happy, and I'm very happy that large goiter is treated as a visually, cosmetically much improved, and her symptoms have improved as well. Most thyroid nodules are symptom-free. You will not have any symptoms. Yeah, no symptoms. So a lot of thyroid nodules are diagnosed as incidentally from imaging or from just a routine screening. But some of the nodules can grow, and if it becomes over 3 to 4 centimeters, it may cause a pressure or compressive symptoms such as swallowing difficulties, what we call foreign body sensation, where when you swallow, you feel like something is stuck in your throat. Some people may just have a hard time swallowing large pills. They're vitamins or calcium supplements.
Is it like already quite big if that's the symptom?
That's right. You most likely can you either feel like palpate your nodule or know that there's something there. But some of the other symptoms are short of breath, shortness of breath, where when you exert yourself, when you're exercising, or positional, where you're lying down flat at nighttime, you may feel short of breath because that nodule is not compressing against the airway. Similar concept to the how the nodule can compress your food pipe from having difficulty swallowing. So some people may have shortness of breath, and some people may even have some voice changes as well, hoarseness, raspiness, or just a fatigue of their voice because of the compression of the voice nerve or just the overall windpipe.
So I heard that this exciting news for these patients might be a candidate on RFA procedure, that thyroid RFA nodule treatment is actually registered in a CPT code. Could you please explain the meaning of this?
Absolutely. That is a big change and a great news for patients, where conventionally, previously the RFA was done as a out-of-pocket expense, but now with the procedure code or CPT code, the RFA is not covered by the insurance. The Medicare, Medicaid, as well as the most of commercial insurance are now covering the RFA. And that's reflected on the guideline as well as the fact that its experience have been built over the years, where the insurance, the payers are now recognizing RFA as a standard of treatment.
This has been exceptionally informative discussion. Doctor, thank you once again for sharing your expertise and clarifying this important topics for our listeners. It's been a pleasure.
Thanks, Dorian. Thanks for having me.
Thank you.
Thanks.